This is Frank, and he is quite obviously a skeleton. Now he's an upright being, he's got 206 bones and he's held together with wires and screws. Now we do have 206 bones, but the difference between us and Frank is that our bones don't actually touch each other and we're not generally held together with wires and screws. So what is it that in us that is holding us together, keeping us supported as an upright being, and more importantly holding this 10 to 16 pound, that's 5 to 8 kilo ball on the top of this very mobile structure? And the answer is, of course, it's the soft tissue, and the connective tissue, so muscles, ligaments, tendons, fascia, etc. But we need to have tension within that soft tissue for it to be able to allow us to have this long, tall, upright form. So what does that mean exactly? What does that look like? Well, first off, let's just imagine the mast of a yacht. You've got rigging lines that are holding that mast upright. Now we have multiple masts and pieces in our body, and so that means that we've got to have multiple rigging lines through the soft tissue. Here is a toy which is a great example. So these wooden bits are the bones and they're not touching each other. The elastic here is the soft tissue. And when we have equal tension in that soft tissue, it gives us balance, it gives us alignment, and it gives us stability and also fluid movement in all directions. So that's like us, and that's what we want to be having in our body. As soon as we have a shortening of the soft tissue in one of those areas, say a hamstring maybe, what it's doing is it's pulling the bones closer together in certain areas, and it's creating tension in other areas, and it's using it's making the movement is no longer so fluid. It's also distorted the shape, so we no longer feel balanced. So we have to change something else to counterbalance and to find a compensation pattern. So we're going to move another part of our body, and to move another part of our body we have to shorten it. So if we shorten a piece over here, then okay, so we're now, we've got some kind of thing. We could probably, live like that for a little bit, but you can see that now the bones are really being pulled out of place somewhere else. It's created even more strain within the structure in the body, and it's now probably hurting some of those knee joints and hip joints and other soft tissue injuries as well. So we go and get those particular symptomatic areas sorted out, but it's only a short-term relief, and we have to keep going back. And now you can understand why, because we're not actually dealing with the places that the problems originated from in the first place. So my advice is to go and find a soft tissue treatment, a deeply relaxing soft tissue treatment, because that way you really get release throughout the whole of the body, allowing the bones to float back to where they need to be, and bringing us back to that optimum place for us, taking into consideration age, wear and tear, and any mechanical intervention. And that will hopefully alleviate any kind of chronic injury pain and repetitive injury strains and things. So yeah.